Bismillahir Rahmanir Rahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today I'm going to explain another lecture that is related to the tumor marker, and it is about the PSA test. We also call that Prostate Specific Antigen test. Okay, if you guys remember, we already talked different tumor markers test, like we have talked CEA test, CA125 test. Okay, so we have already talked this test. If you missed these video lectures, you can go back to my channel and watch this video in a detail. Today I'm going to explain that what is PSA test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. Dear viewers, first of all, let's understand ourselves that what is actually the prostate. Prostate is actually the gland that can secrete a fluid. Okay, this prostate is actually present below the below the urinary bladder, and it is located opposite to the rectum. As you can see on your computer screen, this is the perfect location of the prostate. So it can secrete a fluid that is mixed with the semen during ejaculation. During ejaculation of the semen, so it is mixed with the semen, and these steps of the fluid are responsible to nourish and to help the sperm cells to fertilize the egg, and also help the sperm cell in the motility as well. So this is the prostate gland and their function as well. Now let's move to our topic. Now, what is prostate specific antigen? So prostate specific antigen, also called as a total prostate specific antigen test, or we also call it tPSA or PSA. We also call that kallikrein 3 test as well. Now prostate specific antigen is actually the glycoprotein, or we call it tumor marker. Why? Because it is also used to identify the tumor cells in the prostate gland as well. Okay, I will explain it in later. Now this prostate specific antigen, in case of the male, this prostate specific antigen is produced from the epithelial cells of the prostate gland. Okay, and it is mixed with the bloodstream as well as into the semen as well. Okay, this prostate specific antigen level are very low into the bloodstream and into the semen as well, mostly in the male. In case of the female, it is produced from the breast tissue, it is produced from the amniotic fluid, it is produced from the endometrium, and it is also present into the milk as well. Okay, so this is a very short introduction related to the prostate specific antigen. Now let's see that how many types are there of that prostate specific antigen. There are almost 3, or we can say 2 types of the prostate specific antigen. One we call that total prostate specific antigen, other we call that free prostate specific antigen, and next we call that bound prostate specific antigen. First of all, let's see that what is free prostate specific antigen. Free prostate specific antigen is an antigen that not connect with any type of the protein or glycoprotein, and it can move or float to move freely into the bloodstream or into the semen as well. Then we have bound prostate specific antigen. Bound prostate specific antigen is that antigen that are connected with to the alpha anti chymotrypsin, and it also connect with alpha 2 macroglobulin. Okay, so these are the bound specific prostate specific antigen. It means that it is connected or bound with these 2 protein. Now let's see that total prostate specific antigen. So total prostate specific antigen is that type of the prostate specific antigen that have free prostate specific antigen and that have bound prostate specific antigen. Okay, so this is about the types of the prostate specific antigen. Mostly there is one point that you must note, that mostly the doctor recommend total prostate specific antigen test. Why? Because it contains both bound and free. So that's why the doctor mostly recommend the total prostate specific antigen test. Now let's see the main purpose or the diagnostic importance of this test. The doctor mostly recommend this test to check or to find out the cancer, specifically the prostate cancer. Another point that the doctor also recommend this test to check the prostatitis issue or prostatitis hyper, or the doctor also recommend this test for the prostatitis or benign prostate hyperplasia as well. This test is also recommended to see the treatment efficacy which are provided. For example, if cancer or if let's suppose there is a cancer issue, and if it is treated with the radiotherapy or chemotherapy, so or there is some medicine providing, or if you want to check the treatment efficacy, so we also recommend this test to see the treatment efficacy, either it is working or not. So this is the diagnostic purpose. Now let's see the normal range. Remember guys, the normal range of the prostate specific antigen is less than 4 nanogram per ml. In some of the laboratory it is 0 to 4 nanogram per ml. Okay. There is one point that you must note in your mind that when the value of the prostate specific antigen is more than 4, so then the doctor recommend prostate biopsy to check the cancer cells. Okay. Now then we have the procedure of the prostate specific antigen. This test, the procedure of this test, I already explained it into my YouTube channel. You can go back and watch the procedure of the prostate specific antigen. So it's very simple. So I explain it onto the semi-automated machine like FindCare machine. So how to perform the prostate specific antigen test using FindCare machine. Okay, we can also perform this test on a Mandre machine, Meglomi machine, that is the fully automated machine. Okay, next that for the prostate specific antigen you need the blood into the gel tube or red top or lithium or we can say green top as well. So these are the blood that you must take in each of the tube. Then you will centrifuge it to get the serum or plasma. Then you will run the test. Okay, so this is the procedure. Now let's see the main causes of high prostate specific antigen. So there are different main reasons through which the prostate specific antigen get high into the body. So PSA value may also high. It is due to several reasons, like we have prostate cancer, like we have prostatitis, like we have breast uterine cancer, like we have prostate enlargement, prostate surgery. Okay, and some type of the medicine like finasteride or dutasteride, these are the type of medicine. So due to these reasons, the prostate specific antigen value may get high into the body. So dear viewers, this is all about the prostate specific antigen. I hope you understand. If you understand, so please hit the like button, share this video, and also subscribe the channel to get more interesting videos like that. If you have question, you can write your question into comment. I will try my best to give you answer as soon as possible. Thank you so much for watching.